therapist. Today I'd like to talk to you about some of the assessment tools that I use for one of the most important muscles for hockey players, which is referred to as the Glut Medius muscle. So this muscle here, the reason it's so important specifically for skating for hockey players is its two main functions. So one is it's responsible for keeping the pelvis parallel, and then the other thing is it's the main hip abductor, which basically refers to bringing the hip out to the side. So this action here. So obviously super important in terms of skating, directional changes, T-push and T-slide for hockey players. And so there's a few very specific tests that I'll do in the clinic to assess the strength of this muscle without actually doing any sort of direct muscle strength testing. And so there's a couple tests, as I mentioned. So the first test is referred to as a Trendelenburg test, and basically what this refers to is one's ability to keep the pelvis parallel when balancing on one side. And so what'll happen is if this muscle, this Glut Medius muscle, if it's weak, the patient will, the pelvis will essentially drop on the side that's weak. So, for example, if I was to balance, right, put all my weight on my right side here, and if my hip, right, leaned off to the side like that, that's one of the tests that we would do to determine if there's weaknesses in that particular muscle. Another test that I would do is actually have somebody do a straight leg raise test on their side. And so ideally what I'm looking for in terms of positioning with this is the ability to bring the hip up and back. So in a lot of cases, right, if this muscle is weak, the patient won't be able to bring it back in that angle. And what'll happen is the leg will either just go into a kind of a neutral position or actually go forward. And so what that's telling me is that the patient's having to recruit other muscles in order to do the movement. And this is one of the main reasons why hockey players will get pain in the front of the hip, or will get pain in the lower back area with skating, is that because that glute med muscle is so weak, they're having to recruit other muscles and essentially compensate and overuse these muscles in their skating stride. And then lastly, the last test that I'll do is referred to as a single leg squat test. And so what I'm looking for here is I'll have a patient again balance and then actually do a single leg squat, and I'll be looking actually at the knee positioning when they're doing this squat. And so what'll happen is if the glute med muscle, again, if it's weak, you'll find that the knee will actually collapse inwards. So this inability, right, to keep the knee in line. So again, just summarizing the three main tests that you can do in order to, again, see if this muscle is weak or not without actually doing any sort of direct muscle testing is the balance test, Trendelenburg test, the straight leg raise test to the side, and just looking at the specific positioning of the leg and the ability to do that and not recruit other muscles, and then finally the single leg squat test. Hope you enjoyed the video. If you have any specific questions or concerns, feel free to comment below, and have a great day.